Hi everyone, and thank you for joining us today for a new episode of All About Aetrex Foot Health Q&A. I'm Tatiana from the Aetrex team, and we're here with our very own Dr. George Ampat. Hi, Dr. George.
Hello, Tatiana. Hello to everyone who's watching us from home or from office.
Yes, hi
Lovely that you have
everyone.
joined us.
Thanks for joining us today, guys. And as you know, April is National Foot Health Awareness Month. So every week we'll be talking about a new foot ailment. This week's topic is bunions. And if you guys are interested in watching our previous lives, we had one on plantar fasciitis and metatarsalgia. But today's live will be focused on bunions. So before we begin, Dr. George, can you tell everyone at home a little bit about yourself and about your research with Aetrex?
Thank you, Tatiana. I'm Dr. George Ampat. I'm originally from India. I did my medical schooling in India, and then I graduated and became an orthopedic surgeon, did my master's in orthopedics from India, and then moved to UK. I've been in the UK for the last 30 years, and I'm an orthopedic spinal and foot surgeon, mainly an orthopedic and trauma surgeon. But a few years ago, I took a change in my career path and said, well, I'm not going to operate anymore. I want to try to help people without surgical intervention. Now, you would wonder why a surgeon did that. I agree, surgery gives you the lot of adrenaline kick, but equally, surgery can be, there are potential complications with surgery. It is not a fail-safe procedure, and about 1 in 5 or 1 in 6 patients following surgery have more problems afterwards than before the surgery. So then it made it clear that we need to try to explore non-operative methods as much as possible and not depend on surgery. Now, when I talk of surgery, you must understand surgery can never be completely undone. If I buy a house, I don't like the house, I can reduce the price and sell it. But that's not with surgery. I can't reduce the price and sell it on eBay. The surgery, I'm stuck with the surgery I've had. Yes, there may be an implant that is inside. That implant can be removed, but that surgical incision, the surgical scar is permanent. That can never be removed. So if it has damaged nerves, and the pain from those damaged nerves is going to be permanent. So unfortunately, we cannot undo surgery that is done. Hence the reason to explore non-operative methods. I'm not saying surgery is bad, but we need to do surgery only when it is needed and after we have exhausted all non-operative methods. So in that venture to attempt to find non-operative methods, that's how I came across Aetrex. And I have to say it was love at first sight. As soon as I saw Aetrex and what benefit it was doing for my patients, I decided this was something we need to investigate more. Then slowly, I started recommending it more and more for my patients. And then I had a relationship with Aetrex. And now actually that relationship has matured to a degree that we are now having a separate unit in UK conducting the research for Aetrex. There are 3 particular protocols we are now following for 3 research protocols. One is to find out whether the speed orthotics is helpful for runners. So running is becoming a very popular sport. A lot of people are taking on running because it increases cardiovascular fitness, decreases cardiovascular events, adverse cardiovascular events. But because it is becoming popular, more people are getting injured by taking on running. Running doesn't cost. You don't need a club membership. You just put on a trainers and orthotic and start running. But unfortunately, running also causes injury, and injury is painful for the participant and causes them pain both to the participant as well as for the society. So how can we reduce that cost? How can we decrease the suffering and give them more pleasurable time while they are running? And that is why we decided to use the Aetrex orthotics, and we have done some research. It's a pilot study. That's our first one. The next one is on plantar fasciitis. Here we are comparing just with the 420, one of our orthotic alone, or with the 420 and the flip, to see whether there is any difference between these 2 treatment modalities. And we are using different outcome measures to measure over a period of time from baseline 3 weeks, 6 weeks, 3 months, and 6 months to see how they are progressing. The third is we are doing a premium memory foam orthotic in seniors. Now, 1 in 4 patients who are over the age of 60 have foot pain. And unfortunately, foot pain not just affects the feet, it affects general health. Because as soon as you have foot pain, you're not walking much. When you're not walking much, you're not being mobile. When you're not mobile, your muscles become weak, and there is increased adverse events, as we said earlier, cardiac events, stroke, etc. So how do we prevent that? We need to be active. So even when we are old, we need to be active. But unfortunately, that is not the case, and foot pain is preventing them from being active. So by giving them a premium memory foam, are we decreasing their foot pain? Are we decreasing their other musculoskeletal pain? And are we increasing their activity? And are we giving them a better balance and decreasing their fear of falling? That is a third research that study that we are doing, and we have made significant progress. I don't want to reveal the results of the study, but it has been very encouraging so far, and I'm very proud of my relationship with Aetrex and the research that we are doing. So I'm grateful for that opportunity. I'm also grateful for this opportunity to address all of you. Thank you.
Thank you, Dr. George. We're so happy to have you on part of our Aetrex team and part of our Aetrex family. We love having you, especially today on our lives, and just sharing all this great medical information with everyone at home. So let's jump into our topic of bunions. So bunions, it is a common foot ailment. People do have them. Dr. George, can you explain to everyone at home what exactly is a bunion, who gets it, why they get it, what it feels like, everything about it?
Thank you, Tatiana. Now, bunions are a deformity that develops in the feet, and the deformity is mainly at the ball of the foot on the great toe. You can also have a bunionette. A bunionette is where it occurs in the little toe, but a main bunion is where it occurs on the great toe, or where the great toe attaches to the foot, or on the ball of the foot. Now here it's a deformity that occurs inside. The bones slowly change. So if there is different risk factors for it. So yes, it is true that people with different risk factors have an increased chance of developing bunions. On the right, you can see some of the, on the left, you can see some of the shoe factors, and one on the right is also a shoe factor. So let's look at each of the factors, and let's look at it in an anti-clockwise direction, starting at about 11 o'clock. At the 11 o'clock, what it shows is the shoe with a shortened in the toe box is very narrow. When the toe box is very narrow, you're crushing the toes together, and that increases the chance of developing a bunion. The second, at the 9 o'clock position, you're seeing someone wearing a high heel. As soon as you wear a high heel, your entire foot is being squeezed into the toe box, and that is why, again, the toes are crushed together, which widens the metatarsals, increased chance of getting bunions. The third, at around the 7 o'clock position, you're seeing short shoes. It seems to be more fashionable to wear smaller shoes and not wear larger shoes, and people try to fit their feet into smaller shoes. But again, when it is crowded, when the whole shoe is crowded, then again you're cramping all the toes together, and there's an increased chance of developing the bunion. Now, coming again to the figures on the right, let's look at the image at the 3 o'clock position, or where you're wearing flat shoes. Majority of your shoes are flat and do not have a contoured orthotic in it. If you have a contoured orthotics, there is definite evidence that it decreases the chance of bunion formation. So these are the 4 shoe factors, but there are other factors. The one at the 1 o'clock position is flat feet. Having flat feet, and especially age-related flat feet, where you have posterior tibial dysfunction, there's an increased chance of developing the bunion. But the most important is what is at the 5 o'clock position. Here you're seeing the DNA, which means that there is a lot of genetic element in developing bunions. So if your mother, your aunt, your sister has bunions, it's likely there's an increased chance of you developing a bunion. Now, you would have noticed that I used an aunt, mother, sister, because unfortunately bunions, it is very unfair. It is much more commoner in women than in men. For every man who develops a bunion, 15 women get a bunion. Now, yes, operations are useful in bunions, but 1 in 6 or 1 in 5 operations fail, and they require further surgery. So that is why we need to see how we can prevent and treat bunions without surgical intervention. And that is how, if we now look at the deformity that occurs inside, you can see the image, these 3 images. On the left, so this is the silhouette of all the bones in the feet, and you can see there is a normal foot is on the left, But on the second image, you can see a mild deformity occurring. So these are early stages. This is the stage when we need to act. If we act at this stage and wear an orthotic, there is definite evidence that it will not progress to the third stage. When it goes to the third stage and there is dislocation or subluxation of the joint and there is permanent deformity and arthritis, then an orthotic may not help. So early, when you catch it early and use orthotic, that is when you can prevent. Now, though I said that genetics is involved, what we must understand, and also I said that short shoes or in a crowded toe box all can add to bunions. It is not necessarily that everyone who's got a narrow toe box or everyone who wears high heels will develop bunion. You need to have a genetic predilection. And if you have a genetic predilection, I'm sorry about this. If you have a genetic predilection and then you have narrow toe box, you're an increased chance of developing the bunion. So it is like so many other conditions. Yes, you need to be vulnerable. And if you're vulnerable from genetic vulnerability, and then you have the risk factors, then you're likely to develop the bunion. So in one line, if I were to say it, it is genetics that loads the gun, but are these trigger factors that I showed you? There is a narrow toe box, short shoes, high heels. They are the triggers that fires the gun. So it is both the genetic factors or the vulnerability, and then the other factors, which the trigger factors which cause it. Now, if you look at the toes again, there is an evolutionary reason why we develop bunions. Now, the image on the left is the image of a chimp's foot, and on the right is what we get the sort of an image in what is seen in a bunion deformity. Now, as we talked about how we were apes, and as apes we descended onto the ground as humans. But because we were apes, we were climbing trees. And in apes, the figure is like what you see on the left here, and they need to grasp on the tree trunk to climb the tree. Now, unfortunately, if you're vulnerable, there is a rotational deformity that occurs in the great toe, and it becomes like the chimp-like features. And it is because there is an evolutionary way, you always revert back to that evolutionary origin, and that is why you develop. So there is an increased predilection, and that predilection or vulnerability is because of our evolution from apes. Now, when it becomes more severe, we can measure the severity by looking at a few angles. Now, here you can see how the deformity is shown. There are two different angles. There is one angle between the metatarsal of the great toe and the second metatarsal, and that's called the intermetatarsal angle. Then that is the second angle, which is between the great toe and the metatarsal itself, that is called the hallux valgus angle. Now, these angles are increased, and can tell, or you can grade the amount of deformity, and helps us analyze whether treatment effects are decreasing these angles or not. So that is one way of measuring the severity of the bunion formation. Next, what I want to talk about bunion, as I told you, this is a weakness of the first ray. The first ray is a great toe, the metatarsal, and the cuneiform all in one line. Now, this entire, what I've shown you in red, deviates. So the metatarsal deviates towards medially, and it's the great toe that goes outwards laterally. And that is why it's called a hallux valgus. But it's not just a two-plane deformity, but it is a rotational deformity. The whole of the metatarsal rotates. So on the left now you can see, as you see from top down, you can see the deformity. But what you can see from the side is that the entire arch has collapsed. So if you can prevent the arch from collapsing, and by wearing a full-length orthotic like what you're wearing now, then you're unlikely to develop that deformity. But it should be noted that if you have a severe deformity, the orthotic is not going to correct that deformity, then only surgery may correct. But the clever thing is not to develop this deformity and to treat it early, just like in cancer. Yes, after smoking, you develop cancer. It's very difficult to cure, but the clever thing is not to develop that cancer by avoiding smoking. So same way here, early on in the disease, you need to wear an orthotic to prevent the deformity from occurring, or at least preventing the deformity from progressing. when it is severe deformity, it cannot be corrected by orthotics. So that should be understood, and we should all wear shoes wisely, shoes that accommodate the orthotic. Now, there are a few exercises that help with bunions, and there are 3 exercises I've demonstrated here. The first 2 are very important. But before I talk of exercises, let me talk to you a little bit of the muscles that control the foot. There are extrinsic muscles and there are intrinsic muscles. So what are extrinsic muscles? Muscles that are actually positioned in the calf, but the tendons become long and insert in the toe, in the foot bones. They are called extrinsic muscles because the muscles are outside the feet and control the feet. But there are multiple small muscles in the feet itself which control the feet. So if the muscle is in the feet itself and controls the feet, it's called intrinsic muscle. But if the muscle is outside in the calf and then controls the feet, it's called an extrinsic muscle. Now, majority of foot problems are because of weakness of the intrinsic muscles. Now, the first 2 exercises develops the intrinsic muscles which prevent bunion formation or at least decrease the rate of progression. So the first one, where you can see the 2 arrows pointing towards each other, it's what's called the doming exercise. You want to make the entire foot like more of a dome. You increase the dome by laying the foot flat on the floor and trying to pull the ball towards your heel. By doing that, you're increasing the arch and you're recreating the dome of the foot. But it's important that you're not curling your toes. As soon as you curl your toes while you're doing this, then you're not using your intrinsics, you're using your extrinsics. Whereas if you just dome, by keeping the toes straight and just by pulling the ball towards the heel, then you're only using the intrinsic muscle, and that is good for bunion, to prevent or at least decrease the rate of progression of bunion. The second one is playing of the toes. So you lay the foot flat on the floor and you try to spread, like how you can spread your fingers of your hand, you try to spread the toes. For that, you need to try to move the great toe inwards and the little toe outwards and hold it out and then bring it back in. Splay and return. Splay and return. Now, the good way of doing it is while you are in, say, in an office, you can take your shoes off and then you can exercise. So you can have an order that every hour or when you're changing your task, you can do these exercises for a few repetitions, and that way you're exercising the intrinsic muscle. The third exercise which is recommended is trying to tiptoe, and that also develops or prevents the bunion. But I'm not in a great favor, but because some research articles do suggest that tiptoeing also helps in bunion formation, I've included that. But my preferred exercises are the doming that is on the left and the splaying of the toes that is in the center.
Thank you, Dr. George. That information is so helpful. And I think really that picture showing all the different shoes and what kind of, creates this recipe to get bunions, high heels, flat shoes, your DNA. It's very helpful for everyone. Thank you. And we did get a lot of questions about bunions, and we actually have a couple questions here that we want to ask you, Dr. George. This person says, I am flat-footed, overpronate, and have bunions. I've been using custom orthotics I purchased through my podiatrist's office that seems to have kept my bunions from progressing, and I rarely have pain. In the summer, I wear my Sydney wedges. Do you have any other shoe recommendations? Also, I've heard some debate about whether it's harmful to walk barefoot. What's your opinion? That's by Mary C. And,
Thank you.
Oh yeah, sorry, just to jump in really quick. Mary C, thank you for wearing our Sydney wedges. They are very supportive. We're so happy that they're helping you. We also have some great styles behind me that we're going to get into the exact details. But Dr. George can definitely help us answer the barefoot question.
Thank you. There are a lot of questions. Actually, there are 3 questions in this one question. So I'm going to answer all the 3 questions. So starting with first, you said that you're wearing customized orthotic. Yes, you can wear custom orthotics, but actually there is no difference. Research shows there is no difference between custom orthotics and prefabricated orthotics. And using prefabricated orthotics like Aetrex orthotics is value for money. I do not know exactly the cost in USA, but I practice in UK, and a custom orthotics is anything from 300 to 400 pounds for one pair, which is about $400 to $500 for a custom orthotics, whereas an Aetrex orthotics is about 50 to 60 pounds, which is about, I presume, $60 to $70. So the value for money, and research shows there is no difference in any foot disorder like in plantar fasciitis, even for bunions. There is no difference between custom orthotics or prefabricated orthotics. So if you want value for money, it is better maybe to use prefabricated orthotics. The second question is you use Sydney wedges, and I think that's a good choice. The other shoe recommendations, I don't want to steal Tatiana's thunder. She's actually going to give us a very good summary of all the shoes that are available, which are good for bunions. Now, very valid point about barefoot. Now, yes, we were originally, you must understand, when nature made us, nature didn't give us a shoe to come into the world. Nature gave us, bare feet. But if the way nature gave us bare feet, we were supposed to walk on soft ground, not on hard ground. If nature wanted us to walk on hard ground, nature quite likely, or God quite likely, would have given us hooves to walk on hard ground. We didn't have hooves, we have soft feet. And as I said, we descended from apes and the trees to the ground. We were meant to walk on sand or grass. When we walk on sand or grass, it is okay to walk on barefoot, but if you walk on hard surface, so in the evolution, what happened is early on, as man was discovering, science came. One of the earliest and the most important invention was creating the wheel. But unfortunately, the wheel doesn't go on soft ground. It needs hard surfaces. As soon as we invented the wheel, we made all our habitable surfaces very hard. Now, that's good for the wheel, but that's not good for our feet. Yes, if you can assure that you are only going to walk on soft ground like grass or sand, you can run barefoot. But if your habitable surfaces are hard, like the roads or the pavements or your house floor is hard, then walking barefoot is not going to be helpful. Then wearing intelligent shoes with arch support is important. Now, I will be talking a little bit later, but what the orthotics does is convert inside nature, makes the natural surfaces inside your shoe. So I want to give you two comparisons for you to think. Imagine walking on a soft, sandy, white beach, and also imagine walking on a hard concrete floor. Now, when you walk, it doesn't require any imagination to know that walking on a soft, sandy beach is much more comfortable than walking on a hard, concreted floor. Because when you walk on a soft, sandy beach, your feet are contoured by the soft sand that goes around, and the weight is distributed and pressure is decreased at individual points. Whereas when you walk on hard concreted surfaces, there is no contouring. It doesn't ply around, it doesn't even out the pressure. So there is increased pressure on the heel and on the ball, and that is why it becomes painful. So if you were to cut out that piece of sand and keep it inside your shoe by recreating nature inside the shoe to give you a contoured surface to walk, that is what prefabricated orthotics like Aetrex orthotics do. Thank you.
Thank you, Dr. George. Our next question is from Emma M. She says, "Hi, Dr. George. Are there exercises I can do to help reduce a small bunion?"
Thank you, Emma. Thank you for the very poignant question. As I explained to you earlier, I did show the exercises earlier, but I will repeat them. But before I repeat them, let me tell you there are two different types of muscles that control the feet. There are intrinsic muscles and extrinsic muscles. Extrinsic muscles are muscles that are there in the calf, but the tendons or the sinews are long enough and they come and control the foot. So they are the extrinsic muscle because the muscle is outside the foot and they control the feet. Where there are intrinsic muscles, these are small muscles that are found in the feet and they control the feet. Now, majority of foot problems are because of failure of the intrinsic muscle of the small muscles. So we need to increase the strength of the small muscles. Now, if we can project those exercises. So the one on the left and the middle, the one exercise, these are the two exercises that I like, but the third exercise on the right is also recommended for bunions. Now, what is the first exercise on the left? That's called doming. By doming, you keep your feet flat on the floor and you're pulling the ball towards the heel. By doing that, you're increasing the dome of the foot, and by increasing the dome of the foot, you're exercising the small muscles. Now, it is important when you're pulling the ball towards the heel, you're not curling your toes, because as soon as you curl your toes, you're now using your extrinsic muscle. The trick is here to only use your intrinsic muscle. The second diagram shows the splaying of the toes. That is the next exercise. You keep your feet flat on the floor and then you try to spread your toes out, your great toe coming inwards and the little toe going outwards, the other toes also following suit. And you spray out and bring back the toes. The third exercise is tiptoeing. I'm not a great favor of that exercise for bunions, but it has been recommended. Now, what I would suggest is, if you have a tendency for bunion, is to use an orthotic, and while you're working in the office and your feet are underneath, take your shoes, your feet off your shoes and do these exercises repeatedly. If you give it every hour, you have to change your task, you finish your emails, you're looking at some writing a report, then do a little bit of exercise that gives you something to break the task, a 5-minute break, and also you're exercising your feet, and there is more circulation in your feet are going to be made more healthier.
Thank you, Dr. George. Next question is from Barbara. She asks, does rheumatoid arthritis make bunions worse?
Thank you, Barbara. Yes, in rheumatoid arthritis, when the disease is very active, you have an increased chance of all deformities, because the rheumatoid arthritis eats away the joint surface of the synovium. There is a synovial proliferation, and that eats away into the ligaments, and that's why you get deformities. And unfortunately, bunion is one of the deformities that you get, so it is increased. But I have to say, some of the recent medications that are there in the market for rheumatoid arthritis has decreased the chance of deformities. When I did my initially in when I became a doctor, that was nearly about 30 years ago, I used to see a lot of significant deformities from rheumatoid arthritis, but now I see much less deformities. And that's because of the new medications called biologicals, the monoclonal antibody medications, and they are controlling the amount of deformities that is occurring. But as I said, orthotics are also likely to help you with decreasing the chance of developing these bunions.
Thank you, Dr. George. And our last question is from Jennifer T. She asks, if I have a bunion on my left foot, does that mean I will eventually get a bunion on my right foot?
As we were looking at it earlier, there is a genetic predilection. So if your aunt, your mother, your sister has a bunion, you're likely to get it. So same way, if you have a bunion on one foot, you're likely to get a bunion on the other foot too. It's not necessarily always true. As I said earlier, it is genetics loads the gun, but it is a trigger factors that fires the gun. So yes, if you have a genetic predilection and then you're wearing narrow shoes or high heels, then you have an increased chance of developing the bunion. But though you have a genetic predilection, you're doing the exercises, you're wearing an orthotic, then you're stabilizing your first ray or the great toe, and thereby you're not creating the rotational deformity. And by not creating the rotational deformity, you're preventing the bunion from forming.
Thank you, Dr. George. So yeah, everyone, thank you for submitting your questions to us. We hope this medical information was very helpful to you. We also wanted to let you guys know that we have Aetrex foot scanners all over the world, all over the US, and we really recommend you go get your foot scanned. On our website, we have a store locator, and you can go find a foot scanner near you, and it tells you amazing things about your feet, like your pressure point, your arch type, your heel, your arch height, what size you are. So we have a scanner here. I'm going to go jump on it right now. So I'll see you guys in 1 second. Okay, so here is our scanner, and there are 4 3D RealSense cameras here. And underneath, we have over 5,000 pressure sensors that can help figure out what kind of feet we have exactly. So the first step is you want to stand on the scanner, And you're going to want to make sure your pants are rolled up. You can wear your socks, you can take them off. And then we click begin our scan. So I'm going to press start, and you want to make sure you stand very still. So right now the sensors and the cameras are obtaining our pressure and taking 3D images of our feet. It's finding out our length, width, girth, instep, arch height. And in just a couple seconds, we're going to have all this very important information. Sorry, okay, here we go. So this is my exact foot scan of my feet. And you can get this scanned, you can get your feet scanned anywhere if there's a scanner near you. You can also email it to yourself. So right here, you can see that I have a lot of pressure in my ball of foot and heel areas. I have a little bit more pressure in my right foot here. And on the left, on my profile, you can see my arch type, my length, width, instep, arch height, girth, and my median shoe size. So it's saying that I have medium arches. And then if I click here on my orthotics, the scanner, this is the Albert 2 Pro scanner. It is recommending the best orthotics based on my foot scan. So it's recommended the L2300 Premium Memory Foam Orthotics, which I actually have here that I'm going to show you guys how they help with bunions. And on the left, you can see my pressure map. And if you guys see all that redness, if I were to put on these orthotics, you can see how all that redness goes away. It is a very neutral now pressure across my feet. There is no red areas. Everything is very neutralized. And the orthotics are going to help offset the pressure and help prevent my plantar fascia from stretching. And then if you click here in the 3D measurement, this is also great. You know, if you do have bunions, if you don't have them, if you want to see if you're kind of forming them, right here, this is kind of an angle of me looking down at my feet. You can see I do not have any bunions, but if I did, I'd have them stay, you know, you can actually see them here towards the inside, the medial side of my feet by the toes. Here's just a 3D image. This is very helpful. And also based on where you're getting your foot scanned, they can recommend products based on your specific foot profile. So these are great ways to find out more about your feet, is trying out an Aetrex scanner near you. So now I'm going to go over on the other side and get into the products with you guys. Hi everyone, so thank you for watching my foot scan. So you guys can find a scanner near you going on aetrex.com. And I also wanted to share, for the month of April, we are giving out free shipping, free ground shipping all month long. So if you guys have been eyeing a pair of shoes or orthotics for yourself, maybe they're a gift for someone, now's your time to get them. There is free shipping. We also recommend signing up for our Aetrex Rewards loyalty program, where the more you spend, the more points you get, and the more you save. And we also want you guys to sign up for our emails and text messages so you can be the first to know about new styles, back in stock items, special sales, fun events like this. So let's jump into the products. Our first one is our memory foam orthotics here. So these are our L2200 memory foam orthotics. Oh wait, sorry. Wrong memory foam orthotic. Here they are. They are $74.95. And a great thing about these orthotics is that they have our Aetrex signature arch support built in. So as Dr. George was saying, you know, we really want to create nature inside of your shoes, and this is how our orthotics help. They have arch support that's built in, and this helps relieve your plantar fascia from stretching, which helps relieve plantar fasciitis, heel pain, arch pain, helps stabilize your body. It has a layer of memory foam cushioning. It has copper guard antimicrobial lining as a top cover. It comes in women's sizes 4 through 13 and men's sizes 7 through 15. And the memory foam cushioning, guys, that is where it's at. It is so comfortable. If you have bunions, it's a great feature to have. is the memory foam cushioning. And this is how our orthotics work. So a lot of shoes come with a removable insole like this. And as you can see, if I were to compare this with our Aetrex orthotics, you can tell that there is just no support in these. They're so flimsy. There's no arch support. These have arch support. They're made with high-tech and premium materials. They aren't hard and they're not flimsy. They are supportive and flexible. And this is how they work. So you just take out your insole and you just slip them in. And it's that simple. They go right in. And we have so many orthotics for different versions, for different, different topics or activities like running. If you play sports, if you go hiking, if you're on your feet all day, memory foam is great for those who are on their feet all day because it feels like you're walking on clouds. So if you're a nurse, a doctor, a chef, a mailman, policeman, these are very comfortable. The L2200 memory foam orthotics for $74.95. The next orthotic we have is our L2300 premium memory foam orthotics. So these are very similar to the previous pair, except they have 43% more memory foam in the forefoot area here. And they are $79.95, and they come in sizes 5 through 13 in women's and sizes 7 through 15 in men. And that memory foam cushioning is very helpful for bunions. And they work the same way. You just take out the insoles out of your shoes and you insert the Aetrex orthotics. And keep in mind, since these do not come in half sizes, our orthotics only come in full sizes. You're going to want to size down if you are a half size. So for example, if you wear a 7.5, you're going to want to get these in a size 7, and that'll just give you some more room in the shoe as well. So you're going to want to have to size down. And the last pair of orthotics is our L2400 customizable orthotics for $74.95. These come in women's sizes 4 through 13 and men's sizes 7 through 15. And along with arch support to help stabilize your body, this is a really cool part, okay? Look, this is our patented mosaic technology. These orthotics have gel pods right here. And these gel pods can really help customize your relief. So it's located in the ball of foot, under the big toe, and also in the heel area. So the way these work is you can just peel off the little pods here. So for example, you can just peel these off. And this helps relieve pressure in this area. So if you have a bunion, which is this area here, you can remove just the pods. You can take out this whole area. You can take out the entire square. They stick back on too. So if you want to just customize it and try them on at home, you can do that, wear them for a day and just play around with these pods. This is amazing technology here. This is really going to help customize your orthotics without paying the customized price because they're only $74.95. And as Dr. George was saying, custom orthotics can range anywhere from $300 to $500. It's very expensive. And this is just a fraction of the price and you get amazing support. They have a Copper Guard antimicrobial top cover, and they have ProShox polyurethane for high energy return. And they are great for those who need that custom relief.
Just to add what Tatiana said, one of the questions I'm raised in academic circles is why do we need a foot scan? And the answer is very simple. 30 years ago, when we changed our car tires, we never aligned our tires or balanced our wheels. But nowadays, when we change a car tire, we balance our wheels and align our tires. So same way, our feet are much more valuable than our car tires. Our car tire goes about 25,000 miles in a lifetime, but our feet go about 110,000 miles. Rather, our feet take us 4 times around the globe. If our feet are serving us so well, it is important that we are aligning them and balancing them well. And the easiest and the simplest way, I'm not saying that we have reached the end of the the identifying features or the investigation. But this is the first a couple of steps. I mean, Aetrex has been constantly, the technology is developed. They're developing technology to create better and better scans to understand the feet better, and we are able to align it and give the best sort of suitable orthotics for every feet. And the customizable one, which Tatiana is holding in her hand, because of taking off the gel pads, it gives an extra space, especially when you have pain in a bunion. It is not the deformity that causes the pain, but the little bit of arthritis, the bursa that forms, the nerve underneath that gets compressed. By removing away that gel pad, gives you that little extra space for that nerve, little extra space for the bursa. There is no pressure on it, and that is how it relieves the pain. That, and majority of the people who have a bunion, if you take away their pain, they don't want an operation. They are happy to cope with the remaining. So it's how to remove the pain, and this may be a very simple step in removing their pain. Thank you, Tatiana.
Thank you, Dr. George. And also, this material here is also, very cushiony. So this is great as well. And the base layer is actually thermoplastic urethane for shape retention. So all these comfort features built in really help relieve any kind of pressure and help support your feet. And these are $74.95. And again, they come in women's sizes 4 through 13 and men's sizes 7 through 15. And these are the customizable orthotics. And now going into the footwear, we have a pair of our Angie sneakers here, and these are $109.95. These sneakers have a removable insole here that has arch support built in. And what arch support does, it helps to stabilize and align your body, and it helps relieve common foot pains like plantar fasciitis, arch pain, heel pain. They also have our Cobra orthotic technology built in. So this Cobra design helps to cradle your heel, and the extra cushioning here helps relieve forefoot pressure. And these come with a pair of Angie sneakers. So a great thing about these two is if you wear a different orthotic, let's say you wear the customizable ones, right? You can just remove the insole that comes with these and just insert these inside. Along with some great comfort features with the Angie is that if you have bunions or like top of foot pain, they're made with a stretchy knit material that really molds to your feet. So instead of wearing a sneaker, like a leather sneaker that's really just tight and it has a lot of pressure on your bunion area, this is great. This is a stretchy knit material. They are so comfy and supportive. They mold to your feet. They have a padded heel here for extra cushioning, a stretchy collar. They have pull tabs for easy on and off. And they have strategically placed pods here for durability. These are the Angie. They are $109.95. They come in so many different colors. You can see here, we have the rose, we have the burgundy. They are just lightweight comfort, very supportive, come in lots of different colors, and they come in sizes 5 through 11 in women's. They do not come in men's. And then the next style we have is our Jillian sandal. So if you guys at home, you guys know Aetrex, you definitely know Jillian. We love the Jillian. It is a fan favorite. Along with arch support, they have memory foam cushioning throughout the footbed. So as Dr. George was saying before, memory foam is very helpful if you have bunions. It's very comfortable. They are $124.95. And I love this feature about them. They have these strategically placed straps here that help relieve pressure from your bunion area. We actually call this a bunion pocket. So it's a great secret little feature that no one knows except you, and this will help relieve pressure off your bunions. They have adjustable straps here for the perfect fit. So in the summertime, if your feet swell up, you can always adjust them with these straps. If you have a wide foot, a narrow foot, you get that customized feeling just with these hook and loop closures. And the Jillian also has a Met bar pod here that helps relieve forefoot pressure. They come in lots of different colors, and they come in sizes 5 through 11, and they also come in half sizes. So definitely check them out. Here is the Jillian in white. Again, guys, so many colors, you name it: leopard, snakeskin, red, blue, yellow, gold. We can go on and on. There's a lot of colors, so check out aetrex.com. And the next style we have is the water-friendly version of Jillian, is the Jillian Sport. So if you kind of look there, side by side. So the Jillian Sport has the same comfort features built in as Jillian, except they are water friendly. So they can get wet and they will dry to their original form. They are $69.95. They have arch support built into the footbed. They're made out of a lightweight Ultra Sky EVA foam. So they're lightweight, they float. They're a great sandal to pack on a trip because if you get them wet, that's okay. You can definitely put them in your bag. They are going to dry. They're not going to add any more weight into your shoes, into your luggage, I mean. And we just love these pictures of people enjoying them on vacation. They look awesome. They come in lots of colors. They also have that bunion pocket as well. And these are strategically placed straps to help relieve pressure from the bunion area. And they have the adjustable straps here and here. And they have a dual density outsole that helps relieve pressure from the ball of foot and heel areas. So the comfort feature list, guys, it does not end when it comes to Jillian. There are so many. And they come in full sizes only, sizes 5 through 11. They're $69.95, and they come in lots of colors. This was a new color we just launched this season. This is the coral. We also launched the Java and the Sage, so definitely check them out. And our last style is the Maui flips. These are our orthotic flips. They are $59.95. They come in men's and in women's. They have arch support built into the footbed here. And along with Jillian Sport, they are water friendly, lightweight, great to pack on a trip. They have pressure relief technology throughout the footbed with the Cobra. They have a very soft toe post because, guys, wearing flip-flops are really bad for your feet if they do not have arch support or any kind of pressure relief technology. You need that. It is so important. Flip-flops are uncomfortable. They hurt. They're kind of dangerous too. They're just so flat. They don't do anything for you. But here you have a soft toe post. This is really comfy. And you have arch support. And, you know, if you have bunions, the best way is just to not put anything over here. You have to have that open, free space. And this is where you get with the Maui orthotic flips for $59.95. Here are some pictures. They really look great. You can really dress them up, dress them down. We have someone here wearing them with a dress. They come in women's sizes 5 through 12 and men's sizes 7 through 14. And they're great for comfort, all day comfort. And those are our products, and that is our Live on Bunions. Dr. George, thank you so much for joining us every week here, every Friday for the month of April. We thank you, and thank you to all the viewers at home.
Thank you, Tatiana. It's my pleasure. And you're hosting it so well too, Tatiana. Thank you very much for doing that.
Dr. George. I couldn't do it without you, Dr. George, and our team here at Aetrex.
Thank you.
Thank
you for all the viewers.
Thanks, guys. Have a good weekend, and we'll see you Friday, same place, same time.